Hello, everyone, and welcome to RIVE Reflections in Veterinary Education. We have a guest this episode, and so I'm going to turn it over to Catherine, who can introduce our very special guest this month.
Thanks, Bobby. So I'm super excited to have Dr. Shari Lanning here. She is actually the director of the VPA program at Colorado State University. And we met at the Regional Teaching Academy Biennial Conference a few months, weeks, I don't know, a little bit ago in Washington, and had a really good conversation and just for me, it was great because I had sort of my own opinions about things, notwithstanding all the stuff that's been going on in the general sort of professional space. And I was able to have a really great conversation with Shari, and I think it'll be great to kind of get to know her a little bit and get her. Give her an opportunity, I think, to kind of answer some questions that maybe some of us have, or debunk some of the things that are sort of swirling around what's going on there at Colorado State. So I'm going to hand it over to you, Shari, and just maybe you could just introduce yourself a little bit, tell us a little bit about your background and maybe how you ended up in the position that you're in.
Sure, absolutely. So, first of all, thank you all for allowing me to be here. I love the fact that I get a little bit of a voice in this whole event. So, it's wonderful. So, I really appreciate it. I am a DVM, and as Catherine said, I am director of the Veterinary Clinical Care Graduate Program here at Colorado State University that is going to graduate the Veterinary Professional Associate. I graduated from CSU. I'm kind of one of those that went to undergrad, master's, that school, and then eventually came back to teach because I figured I should probably start earning some of the money back that I
Yeah.
paid in tuition. And so I have been at CSU since 2018, but that was not my first academic job. Like I said, I graduated in 2006. We had an amazing class. I loved all my classmates and started practicing in Colorado. So I stayed in Colorado for a few years, and then a lot of you remember what happened in 2008, 2009, when there was a huge housing crisis and market crash, and veterinary medicine was really drastically affected by that. And that did not exclude me. And so I found myself in a position where I had actually quit a job and was having a very difficult time finding another one as a clinician. And I was approached by a headhunter from Ross University that said, "Hey, we see that you have a master's in anatomy and you're an anatomist, and we'd love to hire you." And I thought, well, Caribbean island, that doesn't sound super bad. So I may as well entertain the idea. So I ended up going to the beautiful island of St. Kitts and taught at Ross University School of Veterinary Medicine for 6 years, which is quite a bit longer than most people stay. But I loved it. And I found that teaching was a really wonderful experience for me. And I got to try a lot of new things. And as you know, they have a rolling enrollment. So I had a new set of students every semester, and it gave me a lot of opportunity to test out different teaching styles and opportunities. Um, and then I kind of got burnt out a little bit because it is a lot to teach every semester, and the class sizes were large. So I ended up coming back to Colorado and practicing for a couple of years before deciding academia is really my place and it's really what I love to do. I love to teach. And so came back to CSU about 2018 and have been here since.
That's great. I love that story. I think most of us, well, not most of us, but a lot of us who end up in academia are like, oh, that's never where we'd end up, and then that's where you end up. So,
Yep. Yep.
Yeah,
yeah.
just briefly, I remember in 2008 there were like think pieces of like veterinary medicine is recession proof. And it's like, no, it is not.
No.
Yeah,
Mm-mm.
absolutely. So, yeah, so thanks for that background. I think it's really interesting and really important. And I think before we even sort of dive into the VPA piece of this, which is obviously part of veterinary education now, I think one of the questions I'd like to ask is, so what was it that made you realize after you'd gone back into clinical practice that maybe clinical practice wasn't where you were going to stay for the rest of your career?
Um, that is a great question because I get asked that by students a lot and prospective students. And it's never just one thing, is it? It's a number of different things. And I think part of it is the private equity part of our profession. And I had always worked for a private practice. Uh, and then coming back to Colorado, I signed on to a practice that had just been bought out by private equity. And I didn't know what to expect. And I think in that situation, I loved the hospital. I loved the culture there. The previous owner stayed on as the managing veterinarian, but as she transitioned out and eventually left, we were stuck in this position where they were making more of the decisions that we hear about with private equity, which is decreasing your appointment time, giving you less autonomy with your medical decisions and such, and really pressuring you with your average client transaction. And it kind of felt gross and I didn't like it. Also, I am a single mother of 2 kids. It is tough to be a veterinarian and a single mother. It's tough to be a veterinarian in a lot of things, but I can tell you from my own experience, those two things do not mesh very well. And I found it very difficult to raise 2 children with the hours that we put in veterinary medicine. So there were a couple of things there, and then also that pull towards education. So I was raised in a household where my mother taught for 42 years in public education in elementary school. I used to go to her classes with her and help her with students every once in a while just to get a break from my own classes. And in order to help supplement a teacher's salary, she took on tutoring from our house. So our dining table was actually transitioned into her desk as this private tutor. And she became such an incredible teacher, getting her master's in education and everything, that it was in my environment growing up and this language of learning growing up that I didn't even really recognize until I started teaching. And I kind of started parroting my mom, and I was like, I'm turning into, that moment where you're like, I'm turning into my mother. And it was a horrible but wonderful realization. And I have to apologize, I'm getting over a cold, so I'm a little on the stuffy side. But it was this language that I realized was almost innate because I had been raised around it. And she was very much teaching students with disabilities and various learning disabilities, physical disabilities, adult learners who couldn't read. And it was that idea of universal design for learners before we even coined it as UDL. And so it came so natural to me, and it just kind of flowed with what I wanted to do.
That is an awesome story. I want to throw it over to Bobby and Eric to see if they have any questions, because this is supposed to be a conversation among all of us, not just.
Go ahead, Eric. I always talk too much.
Yeah, it's interesting mentioning your mom's experience and background. I maintain this theory that we actually have classes in America, but we don't conceptualize them the way that they do in the UK. And one of them in my head is academia class, because I hear about people who are like raised by educators, or their parents went to graduate school, even if they're not educators per se. And I think that what I consider like the academic class, like we approach problems and life decisions differently than people who are like raised by entrepreneurs, for example. Not across the board, but this is a working theory in progress.
I love I think the part of your story that I think is really important is, there was a situation, it's a recession in, 2008, things are not going well. And you leverage that and turn it into an opportunity that has really shaped the rest of your career in various ways, right? Like, not that it was perfect, also, but like that maybe without that recession, things look very different. And just saying yes to like a scary opportunity, I think is just a really important thing. And one of the things I like to try to emphasize to mentees, students, and things like that is, it's very easy. At least I know I've had this experience in my life where you're just like, no, I'm not going to do that. That's ridiculous. And then you
Yeah.
stop and you go, well, wait a minute, like why?
Yeah.
And like for me, I've had the revelation, like, I think I'm just scared. And then once I realize I'm just scared because it's like something I hadn't thought of, then I'm like, well, now I'm feeling challenged. Now it's like, all right, well, now you got to do this. So, but I do think embracing things that are scary and different and that we hadn't considered, but sort of come your way, can just turn into some really amazing opportunities. So I really love that you took the opportunity. You said, all right, let's take the leap, and then look what that has turned into. I think the other things that you talked about that really resonate with me is just, what I think was like the ickiness of like profit driven healthcare in general.
Yeah.
It's one of the things that I very much appreciate about working in academia. And I know like, I think we all love to imagine that like, oh, I'm above that. And, if my salary changes, like it's not going to change how I practice medicine. But like the evidence is like, no, it will totally change how you practice medicine.
Yeah.
And I don't want it to. Like I want to practice the I love being able to say like, you can do this or not do this. And it personally doesn't affect like like how much money I make, or I mean, I'm affected by it because I care, but not directly. And so it's that's really important for me. So it was I think that's really nice. We don't talk about that enough. Like sometimes it just feels icky,
Yeah.
and I think it's okay to say that. So I appreciate you sharing that.
And
Sherry,
it's not everyone's experience. And
Right?
I
Yeah.
want to recognize that there are some people that
Yeah.
absolutely love their position in private equity and don't have my experience.
Sherry, you mentioned students come to you and ask about your transition.
Mhm.
What do you think that's about? Like, what do you think their mindset is? Like, what is bringing them to ask you that?
I think there's that old adage of those who can't do teach. And so it's, you know, were you not very good at being a vet, and that's why you chose to teach? I think sometimes it's that, which I think is absolutely hilarious. And we all have those students that kind of poke you that way, which is fun, honestly. It builds character. But I think too, I didn't realize how many opportunities there are with a veterinary degree. And there are so many more opportunities now than there were when I graduated. And, that was part of it is I always wanted to teach. I loved teaching in my master's program and in veterinary school and everything. I would TA quite a bit. And I had always been told that unless you are a boarded veterinarian or have a PhD, you're not going to teach at an educational institution. And so I just kind of put it on the back burner and never really pursued it. And it wasn't until I was approached where I thought, oh, I actually do have this opportunity. This is kind of cool. And I do want to flex this muscle a little bit and see, what it leads to.
Yeah, I personally really can relate to that. I mean, I have a PhD, but it's in education, right? So it's not the traditional PhD that veterinary schools are looking for. And one of the big frustrations for me was like my area of expertise may not be in your clinical practice, but I certainly have expertise to bring. And I really appreciate that there seems to be a change now within the academic institutions, particularly at the veterinary school levels, where they're finally realizing that general practitioners have a lot to contribute, right? Yeah, our specialists are so important. They're 100%
Yeah.
important. We can't do a lot of what we do without them. But let's face it, like only 12% of veterinarians are specialists. 66% of veterinarians are GPs. And I've talked to a lot of people who are like, I actually just had lunch with a student yesterday, and she was like, I don't want to be a GP. That's way too hard. Like, I want to go do specialty because that means I get to focus on one thing. When you're in GP, you have to be everything to everyone. And like, you have to know surgery
He's
and medicine.
100% right about that,
Yeah,
by the way.
dermatology and dentistry, and you have to know all these things. And like, if I go into specialty practice, I just have to know one thing. I'm like, you just hit the nail on the head, right? I think there's a growing appreciation for what GPs have to do and also what they bring to the table. So I love that. And I love that somebody found you and was like, hey, here's this opportunity. We
Yeah.
appreciate what you already bring to the table. Um, and let's get you on board. And then it led you to those things that we've already talked about. And that was a nice, I think, segue when Bobby was talking about like sometimes you get these opportunities that are a little bit scary, but if you choose to take them, they can lead you into places that you never thought they would lead you. And that
Yeah.
leads me to that VPA opportunity because I
Yeah.
think that was probably, I mean, if somebody had approached me about that or I thought about becoming sort of the face of that, I think that would have
Yeah.
been really scary. And so I'm
Yeah.
interested in sort of how that happened for you and what made you
Oh
decide
yeah.
to take that role.
Yeah. No, I think it's very much related to that same part of me that went, sure, I'll move to a Caribbean island. That's the same part that went, sure, I'll do this program. And so there is someone that I work very closely with, Dr. Wayne Jensen, who is kind of a staple here at CSU. He's been here forever and a day. He used to be the department head of clinical sciences. And he stepped down right before we started this process so that he could do this. So been involved in the development and progression of the VPA program for over a decade. So back in 2009, and this is where some of the automatic messaging comes in because I've said this before over and over again. But back in 2009, we had two of our CSU faculty, Dr. Lori Kogan and Dr. Shari Stewart, who wrote on a potentially mid-level practitioner that could fit into the veterinary profession, what that might look like. And we had another faculty member close to 2009 that also published on the large animal side of things, Dr. Frank Gehry, who talked about the potential of a mid-level practitioner within large animal medicine. And it was something that Wayne then picked up and over the last decade participated in various talks, including at our local Colorado Veterinary Medical Association conference about what would this look like within our profession. And continued to have that discussion with AVMA, with CVMA, and various groups. And it was never really something that got picked up. And it wasn't until a couple of years ago where Wayne said, you know what, I'm getting ready to retire. I'd really like to try this. And so let's go ahead and see what we can do. And he contacted me because I have most of my experience right now is in online learning. And when I came into CSU in 2018, the majority of my teaching was in online learning, including in the veterinary program with the 2-in-2 program with University of Alaska Fairbanks. And then that expanded into some CSU online learning with the histology program or histology course and such. So I had quite a bit of experience. I've won a couple of provost awards with my online courses, like have been very successful with those. And so he approached me back in 2022 and said, hey, what do you think about transitioning a little bit to be the director of this? And it was probably a year conversation before we finally, um, did the official title and all of that to where in February of 2023 is when I took on the position of director of the veterinary clinical care graduate program. And I'm very proud to say that we were able to get everything through the approval process within just over a year. Because one of my superpowers I like to say is I am a very organized and efficient individual. And you kind of have to do that when you're putting something like this forward. We had a couple of setbacks related to some of the opposition that we had to take some additional steps in, just making sure that our progress was solid and the reason was solid. And really the reason is set in access to veterinary care and shortage of veterinarians within Colorado and the nation. So based on that, we continued forward. We finalized the curriculum and it was fully accepted by the Board of Governors in February of 25 of this year. And we'll be accepting our first class in spring of 26, so just in a few months.
That's
Wow.
awesome. And I've had an opportunity to already kind of ask some of my questions and have those conversations. So I'm gonna again throw it to Bobby and Eric because they may have questions that are sort of on the tips of their tongues.
Yeah. Well, I think it might be helpful just for anybody listening who just doesn't hasn't been keeping up with this at all, to maybe just share a little bit about like what your program, like what's the vision, what are your goals? Because I also think there's probably a lot of misconceptions around that. So I think it would be really helpful for you to just kind of say like why was this something that was important to you all, and then what is your vision for what this can be.
Yeah, well, as I said, Wayne has been involved with this for, well over a decade now. And a lot of his passion, he used to be a practice owner. And he is very familiar with the statistics and information out there about how many individuals actually go to see a vet, how many animals still don't have access to veterinary care, whether it's in rural areas and there's, veterinary desert, as we say, where, it's a significant amount of time and effort to get to a veterinarian that's available. We have those in rural Colorado. And I think that unless you understand how devastating that can be to some situations, you don't get that impact. And so in collecting some information, both in Colorado and nationwide, looking at the cost of veterinary care, and whether or not private equity is involved in that is, a whole nother subject, but also related to this in that we are getting individuals that really are struggling to pay for their veterinary care, and that's part of why they're not seeing the veterinarian with their pets as it is. So access to veterinary care, spectrum of care is something that I'm very passionate about. It is something that I teach about and we include within this program. And basically it is kind of the driving force behind this that, the idea is that we have very competent and wonderful veterinary technicians, and we have very competent and wonderful veterinarians. But the scope of practice between the two is pretty vast. And so even if you have technicians who are trained to the top of their ability and their scope of practice, there is still a fairly wide set of skills that veterinarians who have been in practice for a number of years are really beyond that. And that's things like changing a bandage. There's something that maybe some technicians are not skilled enough to be able to see when pressure sores are getting out of hand. And that's something that needs to be addressed by someone who has a little bit more medical knowledge about greyhounds or something. If you've ever done a bandage change on a greyhound, it's one of the most terrifying things in this world. So that's something that we probably wouldn't leave to a registered technician, but maybe something that a veterinarian isn't going to necessarily need their skills to address. And this is a perfect example of where someone like a mid-level practitioner would fit in, that would have that medical knowledge, that would be able to assess it, recognize what's going on, consult with the veterinarian, direct the veterinary technicians, and work with that. And it would be at a lower cost to that client for something that truly is a chronic condition, because most bandages, you're not coming in once or twice, it's usually multiple times, and it can be quite expensive. And I'm, just immediately thinking of this one greyhound. That's why I talked about greyhound. I had this greyhound with a lacerated tendon that seriously was like 8 weeks we ended up going with bandage changes, and it was a nightmare. Um, but those are the sort of situations where if we have an individual who has the training and the skills to elevate DVMs so that they can practice at the top of their skills and the top of their game, then that allows them to be able to do what they've been trained to do, which is eventually performing those gastrotomies and those enterotomies and those cystotomies and everything else that DVMs will transition to doing within their career.
So my question is, not to get too far into the weeds, but obviously the State Practice Act had to be amended. So, like, I have a general sense of what RVTs are licensed to do in a lot of states. Like, they can do skin, closures, they can induce anesthesia, like those kinds of things. So, what sorts of skills, et cetera, is different with this?
Yeah, so one of the things that's been introduced that has kind of ruffled a little bit of feathers is the spay and neuter. And keep in mind that when we started the curriculum for this program, we did not have the Veterinary Practice Act changed yet in Colorado. That came later, excuse me, after we had developed the program. And so we were really focusing again on access to care and need within the community, which was really a lot at the shelter aspect. And shelter medicine, I had been to so many conferences locally and nationally where we have shelter veterinarians that are saying, I am offering comparable salaries to what a private equity practice is offering, and I can't get veterinarians into my shelter to work because they don't think it's quality care. And they don't think that they're going to be able to build themselves as a veterinarian within a shelter. And so they have positions that are open for well over a year, 2 years, where they're finding it very difficult to fill those needs. And most shelters have stipulations where animals need to be spayed and neutered before they can leave that shelter and be adopted. So there's this bottleneck at shelters where unless you have that animal spayed and neutered, they cannot be adopted. They're then costing that shelter a bunch of money as they're looking for someone who is able to spay and neuter. So one of the big pushes that we had was that these individuals would need to be able to spay and neuter a dog. Because again, we were focusing on shelter medicine. And that has since changed from Prop 129, Proposition 129, Colorado, that did introduce the Veterinary Professional Associate into our Veterinary Practice Act. So now those individuals can practice, once DORA updates it, in private practice now. So spay and neuter is one of those that technicians would not be able to do, that the VPA would be able to do.
What else? Like interpret diagnostic test results, like do endoscopy. Like I'm trying to think about like the things that we do versus what the technicians do. Like obviously I'm an anesthesiologist, so like local regional anesthesia, a lot of these things are also not spelled out. So for example, locally regional anesthesia, it is absolutely not clear that technicians
Yeah.
cannot do this,
I agree.
you
I
know?
agree. And I would say that, so the last practice I was at, there was a pretty big, sorry, I'm getting like this sunset that's coming in and like illuminating me. Um, so the last practice I was at was very big into dental care. And even with our technicians that were amazing, absolutely trained to the top of their skills, the practice owner and the regulations within that hospital, they were not able to administer local blocks. That was to be done by a veterinarian. Good or bad, most practice I would say that I've consulted with or been in, local blocks are done by veterinarians and not by technicians. So that is definitely something. So my background, I'm have a certification in pain management. And so local blocks are one of the things that I have always been very passionate about teaching, because I think it is such an economical and efficient way of treating and relieving pain, especially surrounding surgeries. And so with dental blocks, it's something that I've taught within the clinical setting, many veterinarians that have worked with me how to do those. Because you'd be surprised, I think, at how many veterinarians do not know dental blocks, and how to administer, or again, there's that little bit of fear of like, when you're doing a maxillary block and you can't see where it's going and you know that your periorbita is right there, it is terrifying. It raises your blood pressure, and it should. It is a very serious and very complicated, maybe not complicated is the right word, procedure that does have some consequences if you don't know your anatomy and if you don't know exactly what you should be looking for complications. So I get why some practices don't allow that. But with the proper training, and again, this goes back to my training in anatomy, and I am always going to be an anatomist. But if it goes back to the anatomy and you know your anatomy, then it becomes a lot safer procedure. So that's one of those. So dental procedures are another thing that we're going to really focus on for the VPA. And where in some states you have technicians that are allowed to do extractions of single rooted teeth, That is a bit of a concern to some DVMs when looking at, well, the canine is a single rooted tooth. And anyone who has done a canine extraction, that is not a simple procedure. You know, you can have an oronasal fistula very easily with something like that. You can break the mandible very easily with something like that. And so there are some very complicated procedures that have been written by individuals that don't necessarily know that, well, you know, maybe we shouldn't just say single rooted teeth, because when that includes something like the canine, I wouldn't have a technician do that, because of the risk of those complications that I just said. But this individual will have significant dental training where they will be able to diagnose dental disease, address it, do extractions, and continue that pain management and follow-up care.
So I have a question. Oh, sorry, Bobby, go ahead.
No, go.
Okay. I guess my question is, I think about my 13 years in practice and the stress that I had regarding just my own ability to do the things that I was supposed to
Yeah.
do on a daily basis,
Yeah.
particularly when it comes to high risk things like surgeries or a mandibular extraction or something like that. And so I think my hesitation as a practitioner is you're talking about putting someone in there with less training and experience than I have,
Mhm.
but they're not responsible ultimately for anything that goes wrong during such a procedure. I, as the veterinarian, am the one who is really putting a lot of risk into that. So, can you help us maybe understand and our audience understand how that risk is potentially could be mitigated, or sort of what the pros and cons are of being a supervising veterinarian who's putting your reputation and your, your license on the line when you hire someone that's coming into this role?
Yeah, absolutely. And I'll first address someone who is getting less education. I'm going to push back a little bit, and that's because we often, in various veterinary programs, we will see veterinary students doing spays and neuters in their third year. These individuals will be practicing spays and neuters in their fifth semester, which ultimately would be third year. So there is no difference there. And the other thing is when you look at, so the curriculum of a DVM program, we have, let's say 120 credits, okay, give or take depending on the program, but let's say average about 120 credits, okay? With those 120 credits, there's a section that's a large animal, there's a section that's exotics, and there's a section that's going to be more advanced veterinary diseases, surgical procedures, etc. What we did to create this curriculum is take a look at the current CSU curriculum, take out the large animal, take out the exotics, because this individual will only work on dogs and cats. And then diabetic ketoacidosis, that's going to be a DVM skill. That is advanced medicine, you know? If you've got a chronic pancreatitis, again, that's advanced medicine. That is a DVM skill. So where this individual will have training, it looks very similar to what you see in those preclinical years of veterinary school that is pared down to just dogs and cats. So a lot of the content is exactly the same that we see for veterinary school, but for this scope of practice, okay, for these competencies. And so mapping those competencies throughout the curriculum and saying this individual will eventually do that, that means they will need to do this before we get to that point. And very strategically and intentionally providing that information and ways that they can show us that they understand those skills and demonstrate those skills throughout the program, even online. And then by the time they get to that in person, you know, one of the things, and I'm not downplaying spays and neuters at all. It is a surgery where things can go wrong. Okay. And let's talk about spays, because that's really where most people have issues. What I found interesting is that in talking to a lot of veterinarians who have an issue with a VPA doing a spay, they had less of an issue when it came to doing a spay on a sheltered dog versus a client-owned dog. So that tells me it's not a risk of the actual procedure, it's a liability concern. So that kind of goes back to what you're saying is How do I, as a veterinarian, protect myself when I am liable for this individual? And it's the same way, we forget that it's the same relationship that we have with our licensed technicians. We send them out to anesthetize, to pre-med, to give medications, to do various treatments under our instruction and under our license. And we often will push them to the edge of their ability and get them fully trained to the scope of their practice, by pushing them under our license. And we do that by communication. How comfortable are you with this? Have you done this before? I'll show you how to do this, train under this individual, keep going. It's the same thing with the VPA. How comfortable are you with this? If you've ever mentored a brand new vet, it is the same relationship. What have you done? How do you feel about doing this alone? Do you want me to step in and be there, and then you can do the next one by yourself? Let me see what you're doing by the end of the week. It is an active mentoring process, and it's going to be nothing different with this individual.
Yeah, that's great for the clarification. I guess I didn't realize it was focused solely on dogs and cats in practice. I also am sitting here thinking, well, I worked with many interns during my veterinary career that had literally done half a spay when they graduated, but then when they were, licensed, all of a sudden they were able to go out and do that on their own under their own license.
Yeah.
So I think that's really helpful for us to understand, as well as the people who might be listening to us. So yeah, I guess the other thing, and then I'll let Eric and Bobby chime in, because it looks like maybe Bobby has a follow-up. But for me, one of the things that I've joked about for a long time, and I don't say this in any way to be disparaging at all, is like you can teach a monkey how to do a spay, right? Like you can teach them the mechanics, you can teach them what they need to do. What really sets somebody who is a practitioner apart from that monkey is our ability to problem solve when something goes wrong.
Yes.
And I think that
Yeah.
is maybe the concern. But then also I think, like your statement that practitioners were less concerned about them doing spays and neuters in shelter animals versus client-owned animals, which I agree it's a liability, but I also think that says something that's not so positive about our profession and the profession in our field, which
Yeah.
could probably be a whole nother conversation on this,
Yeah.
because I think that's something that we probably should explore at some point. So
Yeah.
anyway, I really appreciate that additional information. And it looks like Bobby maybe has a question or comment. So
Yeah, a couple of things. So one, I love the spectrum of care approach. That's something I feel really strongly about. I gave a talk about it 2 days ago at IVEX, talking about spectrum of care. One of the things that I think is really important when we talk about spectrum of care, though, is one, to remember that spectrum of care should not, in my opinion, just be talking about the financial spectrum of care, right? Like spectrum of care, we should be practicing that all the time for all sorts of reasons. And it shouldn't just be like, because I think when we talk about it related to finances too much, there's this implication that the spectrum of care is good care and less good care, which is not the point. Like that's not it at all, right? And so it's simply recognizing like there's actually a lot we don't know about like what it like. The title of my thing is like spectrum of care and the myth of the gold standard, right? Like we think we know what best medicine is.
I have no idea if having a board certified anesthesiologist helps or does not help.
Yeah. Yeah. I was talking about that in my thing. I'm like, I wonder if I could get a surgeon to enroll in a study where we compared whether or not they performed any better than a non-boarded surgeon. I'm like, would they even be willing to put
good luck
themselves
with
out there?
that.
But again, like it's a legitimate question. I also think for a very, very long time, specialists have been either not included in the spectrum of care conversation or have like kept themselves out of it, which I think is ridiculous, because as a criticalist, right, if you have a patient who is in critically ill shape, right, like I should be able to manage that along the spectrum of care and on a tight budget better than a non-criticalist, right? So I do think, but access to care is really incredibly important, and anything we can do. I live in Western Virginia, very near the state of West Virginia, which I frequently call a veterinary desert. It very much is, and we get people from a huge area. So all of those things are really, really important. What I would love to hear a little bit more about, Shari. So I think for better or worse, it's a little bit easier to create like an understanding about, okay, these procedures are something that, you know, a VPA can do, and this is what a veterinarian can do, and this is what an LVT can do. The procedures, there's a danger, right, in drawing the line, because there's always going to be exceptions, but at least that's like, those are boundaries. We can understand that. I think it's the meta. You mentioned like DKA, and like, I'm not sure the average practitioner is qualified to manage a complicated DKA, right? Like, I love managing DKAs, but they're hard. But even like fluid therapy is really hard. I tell my students all the time, if you get to the point where you think fluid therapy is easy, then you are doing it wrong, because fluid therapy is hard. But the lines are really blurry. And so, you know, is your vision that VPAs can manage diabetes, right? Regular old diabetes mellitus, but then when do we decide? Like, how do we sort that out? It's messy, it's complicated. So I'm just curious, like, what is your vision for how do you, you know, sort out those complicated scenarios?
Absolutely. And it's a great question. I think it's one that a lot of people ask. And the way that I think about it is this. Me as a practitioner, when do I know when to refer to an internal medicine specialist, who is my office mate, by the way? When do I know? And when do I talk to my client about when that path is? And when we talk about a good clinician, it is communication skills, I think, number one, which I hate when we talk to them, talk about communication skills as being a soft skill, because it truly is an essential skill. And so, number one, communication. CSU has one of the top communications programs in the nation. It's world renowned. It's absolutely wonderful. That entire DVM communication program has been fit into the VPA program. So we are doing the exact same communication training that our DVM students are doing. Okay. So number one, communication, I think, is essential. I think also that critical thinking, and there is a level of self-awareness. Whether or not you can teach that, I don't think you can, but you can recognize it, you know. So again, me as an example, if I'm getting to the end of my ability, it's talking to those around me, my fellow vets. Hey, I'm not feeling comfortable with this. What do you think? Am I treating this okay? I do my research, I do my resources, I talk to the client, say, hey, listen, I've managed these. This is getting a bit complicated. I kind of feel like maybe I'm at the end of my ability, and I'm thinking about referring you off to, you know, this specialist over here. This is what it would look like. And this is how that relationship would work. That's the same skills that a VPA would use with a DVM. All we're doing is, so if you've ever been in the human medical, you know, realm where you've had to get anything done, most people see a PA before they see an MD. And I will tell you that while it is not the same, we use that as an analogy. Okay, so it is absolutely not the same position, PA and VPA, you know, but I have been to many physician assistants where they tell me, hey, Shari, you know, I think maybe I need to involve the MD at this point and get their opinion, because this is a little bit more complicated than what I'm comfortable with. I see that exact same relationship with VPA and DVM.
Yeah, I think that's a really important analogy. I think about that like years ago. I'm going to a new dermatologist, and they were like, hey, do you want to see the PA or the MD? And they gave us the option. And I
Yep.
was like, and by the way, you can get into the PA tomorrow or the MD
Yep.
next, you know.
Yep.
And then they were very clear, like, if you have something that, you know, they feel needs the MD, like, they're right there, they're available. My question is, and this is a little different, I think, in veterinary medicine compared to human medicine, although I'm glad you brought that analogy, because I was going to ask, that's the analogy I had in my head. Is this
Yeah.
appropriate? But the difference I think we run into, especially when we're talking about access to care, is like, okay, this diabetic is getting complicated. I think it needs to go somewhere else. And the client's like, yeah, we can't afford that. Right.
Yeah.
What happens then? Right. So now the VPA is practicing beyond their comfort, but they're like trying to do their best. Like, how do we protect everybody in that situation? Because as veterinarians, we frequently get put in that situation. And again, as long as I say, hey, this is like, I mean, I'm having to do, I'm not a surgeon, and I'm having to do more surgeries than I would like to do, because what else are you going to do? Right. And so I document, I communicate,
Yep.
but I think that there is a bit of a slippery slope, right? Because if we're not communicating effectively, that's where I think some of the fear comes in. So either you
Yeah,
have somebody who
absolutely.
doesn't know their limits and isn't practicing safely and maybe isn't providing that opportunity, or they get put into a situation where they're beyond where they're comfortable with, but like they're doing the best they can. So, how do we create those guardrails that protect everybody?
Yeah. No, I've seen that with LBTs where they got in over their head. They didn't have the appropriate communication skills or appropriate supervision. And maybe that relationship wasn't a safe relationship with that DVM where they, kind of went beyond and they went to the state board, unfortunately. And there was action taken against them. So, that's absolutely a potential with a VPA is, if they do not understand what their scope of practice is and stick to that, same thing with the DVM. If I try and practice things that I'm not prepared for and I'm not doing what I need to make sure that that is absolutely clear in my medical records and communicate with my client, I can be taken to the state board. So it's the same situation. I think we often try to create a completely new situation when this is all stuff that we're familiar with. We've all been in that situation of crap. I don't know if I feel like I really communicated that with that client. I feel like I may have, but I don't know if they got me. So now I'm in the situation where I don't know what to do and they can't see this specialist and I don't feel like I'm giving them the greatest care. What the heck do I do? You document. You
Yeah,
document, you communicate. And that's the best.
100%. 100% agree with you. And I've reviewed cases that have gone to the board for various reasons. And I understand a lot of it is about documentation. So, how do you teach, how do you plan
Yeah,
to teach these folks about that?
yeah,
So again, that they're protecting themselves, because this is where, for me, the lines are blurry. Like you
yeah,
can do this procedure, you can't do that procedure. Like that's
absolutely.
easy. But the medicine stuff is really challenging.
It is.
And you don't know what you don't know. And so I could totally see a scenario because I see it with veterinarians exactly as you said. And I think, fairly or not, there's going to be a lot of pressure on you all at the
Yep.
beginning
Yeah,
to make sure, so what's kind of your thought process, your plan for how are you
yeah,
going to prepare your graduates
yep.
to avoid these kind, I mean, nothing's going to be perfect, right? And as you said, like, yep, there are consequences for screwing up, but like, you want to provide them some guidelines and guardrails. And so kind of how do you plan to approach that?
Yeah, so I think there's a couple of ways. I can tell you very specifically, there's a first semester course that's animal behavior and welfare. I'm introducing the Veterinary Practice Act and the scope of practice of a VPA immediately within that because it is involved in welfare. And so making sure that from the very first semester, they understand how animal welfare is intertwined with their practice and their ability to practice and starting it very early. In that communications program, so in addition to that, in the communications program, there are paid actors that we involve that are absolutely amazing in their craft. We bring them up from Denver and they have these case scenarios. And we've worked with the creator of these scenarios and the communication expert in modifying them to this role of a VPA. And that is exactly one of the scenarios that we created. You are now in a position where you are beyond your ability. Your DVM is nowhere to be seen. They're not here. Maybe they're on vacation, some sort of a situation where they're just not available. What do you do? And we literally have them go through that scenario with this client who is pressuring them. These actors are intense. I mean, it is like sometimes it's a bit of like PTSD of like, I remember you as a client and this is traumatizing. But, it really truly is pressuring them that you're in this moment. You need to make that decision. What do you do? And then breaking it down with those communication skills of, here's what we recommend. Here's what you did. This is, the exact verbiage that you said. Here's how it is something that maybe you could have adjusted it this way. So they're not going to know until they're in that position. And that is the point of that communication program.
It's awesome.
So yeah, just a little bit of trivia here. When I was doing research with my PhD buddies, we were actually doing some self reflection work. And you're all like, what the hell does this have to do with anything? But my point is that there's this thing called the Sorites complex, which actually describes this exact situation, right? it's this idea of like at what point does a hill become a mountain, right? Is it at 10,000 grains of sand? Is it
Yeah.
10,001 grains of sand? And I think that's really
There's a
what we're
movie about
discussing.
this.
Oh, is there? I
Like
didn't know.
the Englishman who went up a hill but
Oh,
came
yeah,
down a
yeah.
Yeah.
mountain. No.
Yeah. So, I mean, my my major professor would say it much more crudely and elegantly at the same time, which is, sometimes people ask you what pornography is and you can't define it, but you know it when you see it, right? And I think that's sort of a similar analogy here.
Yeah.
So I think that's probably really the case. And I do agree that all of us as veterinarians have been placed in very similar situations. I think the thing that still concerns me a little bit is the idea that as the supervising veterinarian, I am ultimately going to be the responsible party, and it will be my license on the line, not that VPA's license, whatever it is, because even with the veterinary technician, they have a license that they may have to give up or may have, a negative impact on. But as the veterinarian supervising a VPA, I get concerned about that. But then again, that's on me as the hiring and supervising veterinarian to make sure that I find the person that I feel is mentorable, that's somebody who's going to be open to those conversations and is in that situation. So certainly there's a level of responsibility that the individual veterinarian has to take as well. Um, so we're coming up on the top of the hour. I feel like there's so much that we could continue to talk about. Before I ask this big can of worms that we could potentially follow up with another episode on, Eric, do you have anything in particular that's like you really would like to ask or talk about?
Yeah, thanks. So the thing that has been foremost in my mind, uh, and I will preface this by saying that I am cynical and always finding out, follow the money, right? Follow the money and you'll figure out what's going on.
Yeah.
I also interact a lot with the pre-vet student community. And so what I'm looking at is like, oh, they didn't get into vet school.
Mhm.
So then they're going to go into this VPA program. Maybe they'll complete it. Maybe
Mhm.
they'll keep applying through vet school throughout it. And now we're adding 2 or 3 years of tuition and debt onto vet school. Like everyone
Mhm.
wants to go to vet school, right? That's the thing. And so I see this a little bit like a lot of schools have started doing like 1 year masters.
Mhm.
And my interpretation is it's just a cash grab.
Yeah.
And so I say that I don't like want a defense of that necessarily because you can't like correct my paranoia,
Yeah.
But that's like when I see things like this, I'm like, oh, this is a
Yeah.
cash grab. That's just
Yeah.
like my instant reaction.
Yeah. So I will push back on the idea that everyone wants to go to vet school, and I will tell you that in my experience, the students that are contacting me for this program, many of them have said either time or money has kept them from going to vet school. It's no longer something that they want to pursue. They love working with animals. The position of an LVT has a ceiling that they don't want to pursue. They want to do something more than that. This now fits in. There wasn't this position before. So all they had was LVT or DVM. Now that this is a possibility, this is what they want to do. They don't want to pursue DVM. It was just the only other choice that they had. And I think that a lot of Gen Z and Alpha tend to have a bit more awareness of the debt to income ratio when it comes to their student loans. And with that, this is very much an achievable program for them because we are looking at a 1-to-1 debt to income ratio, whereas DVM programs do not have that. There is a significant debt load for a lot of our veterinarians, and that is contributing to some of the mental health issues that we see within our profession. The other thing that I'll say is that I spent 3 years on the CSU admissions committee here and for the DVM program. And it's no surprise, I think we've all heard this, that veterinary medicine is the whitest profession. And there is a lot of privilege that often goes into the applicants that we see coming into the veterinary program. And I think this is nationwide. just based on demographics. And what we are seeing is that you get a student, and I just had this conversation with some of my undergraduate students today. You have a student who happens to be within a really good neighborhood. Their parents have, just enough income to get them into a good neighborhood. They go to a good school. They go to a good school where they now have the option of AP and college courses. So now they get into their undergraduate and they've already got college credit. They don't have to take as high of a credit load. They can volunteer during their undergraduate. So they get the veterinary hours and they have a really good letter letter of recommendation from a veterinarian after those 4 years when they're going to apply, because they've been able to volunteer for that entire time. They also have better grades because they have lower credit load because they came in with college credit. It is this stackable difference just based on privilege, and we see it a ton. I see students all the time that literally started in high school, and you can track it all the way through to see that privilege. One of the things that I really love about this program is going back to the idea that we have the ability to potentially improve this is a dirty word right now in academia, diversity within our profession. And it is something where if you are from a rural community, these 3 semesters of online learning, you can stay within that rural community. You can continue to build those relationships. Hopefully you will go back there. Because 4th semester, yes, you have to come to CSU. We'll do the hands-on learning then. 5th semester, maybe you do your clinical internship near your rural community. If we can, find a hospital that meets the requirements for that. So now you return those individuals back to their community to support their community. Now, is that idealistic? Absolutely. Is that going to happen with every single situation? Absolutely not. Is potentially private equity going to be an issue in this? Yeah, it's already an issue. So why don't we address that first on the DVM side and not worry about it so much on the VPA side when we do have a better opportunity because of that debt to income ratio that is much improved with this program. And those individuals do have a better opportunity to go into shelter medicine and rural communities because of that lower debt load.
I love that you brought diversity into it. And I think it's a word all of us would feel very comfortable using. We are in privileged positions that we can still use
Yeah.
those words, I suppose. But so 2 things. I love that you're thinking about the debt to income ratio. My question is, like, what do you anticipate? Like, it's hard to know, like, this is a brand new profession, like what salaries are going to be and what people are going to pay. So like, how are you kind of calculating that, one? And then the second question is, I agree and applaud the effort to increase diversity in our profession as a whole. And I have concerns, does that drive a bigger wedge, right? And so now DVMs become whiter and richer, right?
Yeah.
And then VPAs and
Yeah.
LVTs, right, is where that's happening. So, it can be a double-edged sword.
Absolutely. So. Yeah. Well, and I think the change to federal loans in higher education and graduate programs is already doing that. So that is a problem. Absolutely. I think it is a potential consequence, but not just because of this, and potentially not even because of this.
No, and I don't mean to think that this is, but again, does it,
yeah.
We're creating a pipeline to go this way, and keeping some of those people from maybe choosing the DVM path.
Absolutely. And, to Eric's point before, as far as, our follow the money sort of thing, some of the feedback I got initially from our dean of the graduate school, who is absolutely amazing. She's wonderful. We had a very honest conversation of, this is a huge master's program. Most master's programs are 30 credits. This is 65 credits. This is huge. What happens if a student gets halfway through this and fails out? What is going on? That is a lot of debt for them to have.
Yeah.
Or to Eric's credit, what if they decide halfway through that they want to go on to DVMs, and add more onto their debt load? The way we came around that is by offering graduate certificates. And so we offer 3 graduate certificates that we got approved by the Board of Governors. And once we go into rolling enrollment, we'll start the application process for those. But the graduate certificates are all within the first 3 semesters of the program. So again, 5-semester program, first 3 semesters are online. Within those online semesters, there are 3 different options for graduate certificates combined within those courses. So what that means is that if you're not quite sure that this is the program that you want, and ultimately you want to go to vet school, you can apply for a graduate certificate, spend a year doing that, pump up your DVM application, go to vet school. Beautiful. Most people do that with other courses because what is the one thing we tell people from an admission side? You need higher STEM courses to show that you can handle the rigor of a DVM program. There you go. If that's what you want to do, that is the pathway you can take. Okay. Also, if you are one of those students that get into the program and fail out, you can walk away with a graduate certificate. So at least you have something to show for that without just failing out with a bunch of debt.
I love that
So-
you're thinking about those things. That's really cool.
Yeah.
Absolutely.
I feel like we could have a whole nother section on this, and I would love to get into the whole controversy that's out there, and I think the sort of overriding information that's been flooding the airways within the profession itself, which we never really had a chance to get into, but maybe we can have you back at some point.
Well, it
Um,
also occurs to me we haven't touched on the neurodiversity,
Wow.
universal design stuff that Sherry's
Yeah, I know,
also,
I
That was
was
my
going
you know,
to
favorite
like
too.
Sherry
Yeah.
does other stuff
I
besides this,
know.
you
I
know?
know,
know.
it's amazing.
We have to book you for
So-
like 3 or 4 more shows, it sounds
Yeah,
like.
I'm okay with
exactly.
that. I'm more than happy to follow up with you all.
Yes, we would love to have you back. But I do want to try to keep it at an hour. I guess I just want to close out by saying I really appreciate the opportunity to have you and to give you a voice to kind of explain and answer some of these hard questions. I recognized this pretty quickly at the RTA, and it was even more reaffirmed here that they chose exactly the right person to lead this program. I think it's going to
Yep.
be great. I think that you are going to do really good work, and it'll be very interesting to see how it all ends up shaking out. I think in the end, we all sort of feel like the sky is falling, but it really never does, right? Like it shakes itself out some way or another, and everything kind of settles down. But I'm really excited to see how it moves forward. And I don't know about these two. I think we're all in agreement that we would love to have you back at some point, maybe
Yeah, awesome.
in the next few months or so, after you started your first cohort, because there is so much else to talk about, including the universal design for learning.
Yeah, there's a lot of good stuff.
Yeah, but also just sort of, I think, what you've had to, I think, for lack of a better word, endure in the role that you're in, and how you've managed to
Oh my
sort of
gosh,
still
yeah,
stay gracious and
that's
thoughtful.
it's rough. It's a rough
Yeah,
gig.
yeah.
I hope
So-
they're paying you really well.
I remember back in 2009 when I first heard about this, and I was just like, oh yeah, that makes sense. Just like, PAs in medicine. And then people were like freaking out. And so then I did a little research. I'm like, oh, they freaked out about PAs years ago too. Like
Yeah, they
it's going to ruin medicine. Everything's going to fall
Exactly
apart.
the
And
same.
clearly that's
Yeah.
happened. So
Yeah. So, and I actually, just so you know, I listened to another podcast that had some of the other players in the VPA, and Mark Cushing, who everybody has an opinion about, but basically said, listen, I mean, the fact of the matter is this is already a law in Colorado. So we can either implement it in the best possible way, or we can continue to try to fight it and make it really difficult. So why don't we just, implement it in the best possible way? And I think that is a great approach, right? It's there, it's law, it is what it is. So instead of trying to make it bad, let's make it the best we can possibly make it. And I think that's really ultimately what this is all about. So any last comments or anything else that you'd like to bring up on this episode before we let you go?
I think remembering that the people behind this program, including me, we're all veterinarians. We love this profession. So, CSU has this history of access to care in veterinary medicine and really intuitive programs. And this is no exception. So, there are a lot of people that saw this and went, this is a good idea. And keep in mind that it's where not everyone will agree with it. It still has a great opportunity. And this is where I get excited. I think the opportunity to improve our profession is there. And I am so excited to see this benefit my fellow DVMs who are out there practicing and really elevate our profession.
Yeah, awesome. Well, Bobby, I'll send it back to you to end it, but I really appreciate you joining us tonight, Shari, and I do hope that we can have you back to talk about some other things too.
Absolutely.
Great.
Yeah,
Yeah, thanks so much for your time and all your passion. It was really fun talking to you.
absolutely. You too.
All right, take care, everyone.
All right. Bye.